Hey, Tizzy.
Hi, Will.
Okay, we've got a few of these under our belt now, and this conversation is so great. I'm so pleased that we had the opportunity to talk with Alyssa Magrum from the Texas Drowning Prevention Alliance, and you'll hear her refer to that as the TXDPA. So when you hear those letters, that's the Texas Drowning Prevention Alliance.
And while that's the beginning of her introduction, you'll hear from her just all the ways that she is and has been involved with drowning prevention and water safety and the passion that she brings to it. And really looking forward to this conversation today.
All right, here is our conversation with Alyssa from Texas. Alyssa, it is so good to see you. Thank you so much for spending some time with us today. Would you please take a minute or two to introduce yourself? Tell us a little bit about who you are and your connection to water safety, and what you do in Texas.
Sure. My name is Alyssa Magrum. I am the executive director of Collins Hope, which is a water safety and drowning prevention nonprofit organization based in Austin, Texas, but we work locally, regionally, statewide, and nationally, and even beyond. So I've been in that role for I'm approaching 11 years in December as the executive director. My connection to water safety really began the day after Colin Holst drowned, 4-year-old Colin Holst, who is the reason Collins Hope exists. He was a preschool classmate of my daughter's. So when Colin drowned, I suddenly had a parental wake-up call that drowning was something I needed to think about. I'm actually a competitive triathlete. I've been in around water all my life. My daughter has been in and around water since she was born, but I really, as a parent, hadn't thought about drowning as something I needed to think of, just like I think about bike helmets or car seats or all those other things that parents think about. So my water safety connection really began when Collins Hope formed in August of 2008. Maybe before that, because Colin drowned in June of 2008. Since that time, I have kind of gotten out, still do the day-to-day, what feels like a 27, 28 hour a day job as the executive director, but also working locally with our Central Texas Drowning Prevention Action Team, as well as I'm the vice president of the Safe Kids Austin board. So I bring water safety to that space, as well as statewide as a board member for the Texas Drowning Prevention Alliance, and then nationally as a co-chair of the NDPA advisory board and some other, been working on the National Water Safety Action Plan. So my water safety story has just gotten bigger and bigger and deeper, if we want to use the analogy of water over the years.
Thank you so much.
Thanks, Alyssa. And hi, it's really good to be here with you today. And while we're going to be primarily focused on the Texas Drowning Prevention Alliance, your connections with these other related groups, please feel free to bring that into our conversation today, because absolutely collaboration and connection are themes that we are hearing in all of our interviews. And so please feel free to do that. But with that, my first question for you is, if you can provide a snapshot history of the coalition, tell us when it was formed and whether there was an initial catalyst or motivation.
Sure. So the Texas Drowning Prevention Alliance was officially formed in 2011. A woman named Linda DeSanders, who owned a swim school in Dallas, in the Dallas-Fort Worth area. I believe she had a personal family member had been lost to a drowning, and she owned a swim school. So water safety became something that was really around her all the time and a passion of hers. And she recognized that in the state of Texas, which is a very large state and very diverse state, that there wasn't a statewide organization working around water safety, any type of coalition. There's a lot happening, but not a group working together. And so she formed the TXDPA in 2011. I think it was probably more heavily DFW, Dallas-Fort Worth area folks, just because that was where she was. But she really did a good job of trying to bring in people from across the state. So for example, I'm in Central Texas in Austin. There were some folks from El Paso, some folks from around the state. And so she kind of gathered us together to work on just figure out what can we do as a state? How can we even start working together? And that's an epic feat in a giant state as Texas. And so that started in 2011, and each year there was some outreach to pediatricians that was done in the very early beginnings as kind of the focus. I remember in being the executive director here at Collins Hope at that time, and I was about 3 years into my work with Collins Hope, but only really a year into my role as executive director. And I knew that the TXCPA was going to tackle pediatricians. So I remember having a conversation with Linda saying, I'll support the efforts of TXCPA in approaching pediatricians in our area, but I'll let you guys do that, and we'll do some other things. And so TXCPA started, there was an annual meeting every year that was, Texas is huge, so it was really hard for a lot of people to get there. But we had an annual meeting for a couple of years trying to wrap our brains and our minds and everything around how to do better water safety and drowning prevention in Texas. So it was started in 2011, and then in 2018, I believe, Linda decided that she needed I think a larger organization or something to sort of house TXCPA, because it was, I think some things in her life were changing. And so at that point, the Texas Alliance of YMCAs picked up, sort of brought in, housed, I don't even know officially what happened really, but they said, we care about water safety because the YMCA has such a strong Learn to Swim program and commitment to water safety that that felt like a natural fit. And it lived there for about 2 years, maybe a year and a half, 2 years. I came on as a board member for the Texas Drowning Prevention Alliance during that time. And then in the next 2 years, it really became not the greatest fit for really the purpose. I think the reason was, and I can talk about this more later, is that the person who was handling it at the Alliance of YMCAs, it was an add-on to their job. And so that wasn't their primary job. And it's a huge job. And that's something you'll hear me say later when I have the opportunity, that it can't be an add-on to someone's job where it's just I don't want to say an afterthought, but where it's really an extra thing they have to do. And unfortunately, that's kind of what happened. And so then it moved in the last 2 years, and right before COVID really hit, there are a few of us who are on the board here for the TXCPA that have been kind of trying to keep it afloat, trying to figure out what to do really, and trying to figure out how to mobilize such a huge state around something that is so big. And you asked about the catalyst, and I think that the catalyst for having a statewide Drowning Prevention Alliance is really because it's such a giant problem here in Texas. I mean, granted, we're big, but on the average, and these are just child fatal drownings, we average close to 100. We lose close to 100 children in Texas every year to fatal drownings. That's not even counting non-fatal drownings. That's not even touching the adults that we lose. And those numbers are big too. So that was the catalyst, was that we have to do something as a state, really. And I give credit to Linda for really being the first person to kind of try to wrap herself around how to even do that.
Thank you. Thank you so much. And it needs that explanation. So thank you. Just one clarifying question.
Sure.
When you gave that figure of 100, what ages of kids are you talking about?
So that's 0 to 17.
Okay. Thank you.
And we work with the Texas Department of Family and Protective Services to have that real-time number as best as we can. And so that's the data that we lean really heavily on, is that data, because it's pretty up to date by the minute. Like, I checked the stats before I got on this interview, and so that's a number that we can lean on because we know that it's pretty accurate.
So can we follow up on that specifically? Because I think that is like the goal for a lot of different organizations around the state, is to get some sort of system in place like that. So how did that system start? And who, you mentioned it was the Department of
Family and Protective Services.
Okay,
Yes.
so you're only getting pediatric drowning deaths.
And that's what I was saying. Yeah, that's just the that's just the child data. The rest of the data, it's just between it's hard.
So can I ask a little bit about the relationship between the TXDPA, the Drowning Prevention Alliance, and the Department of Child and Protective Services? How did that connection start, and how is it maintained?
Sure. So there's a website you can go to and you can look at that, the numbers that I'm talking about. And they have certainly been the person who puts it up on the website and who tracks that has certainly been engaged in conversations with TXCPA, but we have a really solid relationship. And we've been able to make suggestions around how they report that on the website. So whether, by location, so I would say it's a relationship of asking for it and then having a person, this is key, having a person over there who is passionate about wanting to make sure that data is available. And he has the gentleman that does it has a history in water safety and drowning prevention and a personal story around water. And so I believe that a lot of the reason we have that is because of that one human who believes that it should be available.
Thank you for describing that, because I think there's a lot of groups out there trying to do data better. And what we found is that everybody is doing it in a different way. And there's no right or wrong, but it is so
frustrating though.
But it's so interesting that we've got all these different tools, right? Some groups are working with EMS and some groups are working with Family Protective Services and other groups are working with public health. And so it's good to hear, I think, all these different examples of the ways that we can do it. Back to the Texas Drowning Prevention Alliance, can you briefly describe how it's currently organized in terms of maybe leadership and who's involved and what people involved? How are people involved?
Sure. So currently the leadership sits with the three of us who are the current board. And we're really, I'll be quite frank and honest in saying we're struggling with figuring out how to keep it going. We each have our own organizations that we're trying to run, and that is a huge challenge, as well as I'm co-chairing our Central Texas Drowning Prevention Action Team. So it's like at all the levels and working at the national level, at all the levels, there's not enough time in the day or energy to be honest. And what the strategy that we're currently using is utilizing where each of us as board members is in the drowning prevention space in the state and trying to bring in all of our partners that we work with and keep them engaged. So for example, if it's Texas Parks and Wildlife that we work with at the local or the state level, bringing those people in at both of those levels because they function locally and they function at the statewide level. And it's a challenge. I mean, I will be honest. I know when you asked me to do this interview, it's a little bit, we're in a little bit of a dicey spot. And I feel like how it's happening right now is a lot of maybe not formally organized systems and structures, but a lot of partnerships and collaborations that are working and sharing of resources. And I'll name Safe Kids in this because we have lots of Safe Kids coalitions across the state. And so we try to link up those threads, so to speak, as well as all the different parts and pieces, whether it's there's swim schools that are working statewide or in regions. And it's a lot of just partnerships and collaborations. And I would honestly say there's not a lot of formal structure right now because we don't have the resources to do it. And I'll go back to this, and I probably will say it 100 times in this interview. There has to be a person who owns it or who is full-time on it and honestly funded to do it, and who is not trying to be in 17 different hats. I mean, I know I get phone calls because I'm on the board, and I'll get a media call that says, someone from Texas Drowning Prevention Alliance, and I'll put that hat on, and I might be wearing my Collins Hope hat for part of the time in that interview or whatever. But it's a struggle. It's a struggle because we don't have a safe home with a structure around it that's sort of the puppeteer, so to speak.
So on that line, it sounds like this partnership and collaboration is in fact a real central output of what the Alliance does. And I wondered if that's true, if you can validate that, and then if there are any other kind of key activities that the Alliance is involved with, or is it really about the connecting piece?
I think some of it is for sure about the connecting piece and sharing resources. I know that we were able to pull off a couple of years ago, I think it was 2019, right before COVID. Everything's like before COVID, during COVID, or, but we were able to pull off a day at the Capitol where we had we had some legislative briefing, and we put up a number of the Texas families that are part of Families United to Prevent Drowning, put up the Not One More banners in the state capitol, and we had a proclamation. And that was really, really great, because I feel like we had good representation from across the state that showed up at the Capitol, and we showed that collaboration in that particular event. We have had some really nice sharing of resources across. So for example, Cook Children's has a Lifeguard Your Child campaign with some really great public service announcements and things like that. And those have been shared, and multiple partners across the state, I think, have used those. I know our water safety cards at Collins Hope are kind of shared as a resource, as well as our water safety quiz. So I think that the collaboration and the connections is for sure right now the foundational piece of TXDPA, as in not some sort of really great structure of we have monthly meetings and we have these coalition things, because we're all working so hard in our communities. And I think that's because there isn't someone who's just sitting in a state office somewhere making sure that those the structure is there. So a lot of it is at the output, as you said, Tizzy, what is around the collaborative pieces. And I know that if just the network, to be honest, I know that if I see something that happens in, say, El Paso, I know some of the members that were representing El Paso, I know that I know where they are. I know that there's a drowning prevention coalition there, and I can reach out for them. So some of that too is just identifying the spaces where people are working across Texas, and knowing that if I need something with beach safety, I know I've got the people in Corpus and Galveston that are working and doing more around rip current or beach safety. And so we can lean in on those. And I think that's a thing that's naturally happening versus having a conference or having something like that. Where I wish we could get there. And I think that maybe when we get the national plan and we get a little bit of, I think funding is a piece that I will use that F word, like funding. There has to be some funding from somewhere, because someone has to pay for it. It costs money to have a sustainable organization.
So it's so interesting to, well, I guess, first of all, thank you for sharing candidly with us about where you guys are. I think that it's super important that people listening to this understand that there are really high and great times in a lot of these coalitions, and sometimes there are difficult times. And so I'd just like to thank you for being honest and candid about where you guys are with that.
Sure.
It is interesting to me that the coalition really has survived on this, from my perspective, has survived on this informal partnership, network, collaboration system without a whole lot of infrastructure and guide rails. And so I think if there's any lesson to learn, that it's really important that we put our energy and time into fostering those relationships.
Yes.
And building those connections and spending time kind of nurturing that aspect of the coalition, because in 3 years and 5 years and 10 years, we don't know where we're going to be. And that's what's going to keep us going. Right.
Well, thank you for pointing that out, because relationships, and that is so key. I mean, we have a TXDPA website, and when I can figure out how to get in there, I change some things and update some things. But really, it is about that having the relationships and knowing that we can, it is really, I think you used the word informal. It feels really informal. And when I was preparing for this, part of me was like, oh no, what am I going to say? Because I don't, you know, it's not a rosy picture right now, but I will say it's an honest picture of what I'm talking about. And I think that is where, if people are going to learn potholes to avoid, or, you know, things that are positive that they can, I want them to know, to hear the real stuff. I don't want to candy coat, because what are we going to learn from that? I mean, who's going to be helped by that? So yeah, this is how it really is. And we can, I do think that we have a ton of amazing work happening across the state. And that is what allows us to kind of be sustaining in that way, because there is a lot happening.
I want to ask you about some of the successes that you feel the coalition has had, or the alliance has had.
Yep.
I mean, you've already mentioned the partnerships and the network as being a really strong element. Are there any other successes that you are like really proud of and want everybody to know about?
Well, I think the original work around with the pediatricians was really great, because there was an MOC, and excuse my, I don't know what that stands for, but it's basically a module, education module for pediatricians that were wanting to put more water safety into their visits with patients. And there was some work done around that with pediatricians, which is really, really great. And we're still trying to expand on that work, as well as we do work with the Texas Pediatric Society and to try to work with our pediatricians. So that, I feel like, has been a really big success that continues on even through the iterations of this organization. I think when we had our statewide day at the Capitol, that was a really nice success for us to get a statewide proclamation, as well as really have representation from across the state coming together. Constantly our messaging, we're trying to, I think this is a success in progress. So we're trying to line up our messaging so that we're all saying similar things across the entire state. So I'll use the example of, we used to, and still a little bit, but are transitioning away. We used to use the term water guardian instead of water watcher. And through some of my work at, you know, on the action plan and through some other work across the state, we are shifting to, okay, let's all use water watcher as a word that we can all line up behind. And let's use that word. People can understand that word. And so some things, I feel like that's a big success, because it's weird, but, you know, when you let go of terms that you've used, there's territorialism that you just have to put away. And it's for a lot of us, at least for me, in working for an organization that was founded after a child drowned, it's a legacy. It's a little bit of a legacy piece. Sometimes the way that we say things. And I think that's something that I'm really proud of across Texas, that are all the families that have lost or almost lost children, all the swim schools, all the organizations that are part of this, I really feel like are seeing the value of working together. And that is even in the tiniest ways. And I think that is a huge success, because every time someone chooses to work with someone and chooses to get out of their own silos, it's an opportunity for doing more and more and more of the work. And I would say, in a state that's as large as this, anytime we can do that, it's a success. So I look forward to a future, I'm going to just manifest it here, a future Texas campaign, of a billboard campaign or a public, health campaign. I know that's something I dream of at the national level that we all can get behind. But I think that those successes, sometimes our successes have been really small, and that's just adding a partner to the group that hasn't been part of the conversation. And sometimes that's people that are outside of water safety. That's some corporate partners that might not have water safety as their primary thing that they're doing. And I think that's a success too, because we've got some partners that we're starting to work with that are not just water safety people.
You're so right that words matter. And sometimes it's so hard to bring that consensus around a term. And then when you do, it really helps to build consistency and messaging out in the community. Yeah. So what advice, I'm going to shift us for our last few questions and ask you what advice you would have for a newly forming water safety coalition.
I would say find a person who's going to be the puppeteer. I think that that's so key. If possible, find someone who can do that as their primary function and not as an add-on and not as trying to do 75 other things, because I do think that that is so important. And that's something that we're struggling with here. I think having a blueprint, at least to work from, whether it's an action plan, whether it's when the national plan comes out, it's a statewide plan that is able to be follow that, but flexible for what's happening in your state, but have some type of roadmap that everyone is aware of and that everyone is working towards. Because I think if no one knows what you're trying to do, then how can everybody get behind it, right? And then, knowing your data the best that you can, knowing what's actually happening in your community, in your state, and then in your communities, I think is so important. Finding some funding, even if it's one grant or one little pocket of money that can help with things like ads or PSAs or a person or something, but being able to find a funder who can who's willing to put some money in it, because you can get lots of in-kind things and you can do that, but there are some things that you just have to have some money at the table. And I think it also adds validity and credibility to our work if we're not always just asking for everything as a donation. So I would say find some funding somewhere, even if it's a community foundation or a bunch of community foundations that can each put it in there. And then I think be willing to look outside and see what other states are doing and what they've screwed up. Like, I think there's so many lessons to learn in the failures. I know if that's one thing I've learned in my adult life and in my life leading an organization and multiple organizations is sometimes you got to take some risks, and sometimes it is not always going to work out how you want it to. And so then looking at that and saying, what can we learn from that to not do it again? And then look at other people's, because you can avoid pitfalls. That's why I'm so happy to be part of this conversation, to maybe help our friends in California to avoid some of the things that we've, the pitfalls we've had. So I think that's pay attention. It would be, pay attention and communicate and form those partnerships, because the partnerships are going to allow those of us who have strengths in certain areas to work from our strengths and to work with, with each other's strengths. And where we don't have a strength, someone else in our collaboration will. And I think those are probably the big ones. I could probably go on forever, but
Alyssa, you've just
amazing.
Dropped, you just dropped so many on us. So to quickly recap, get a dedicated person, have a blueprint or a plan, know your data, get some funding, even a little grant, be willing to look outside and learn and focus on partnership.
Yep.
Wow.
And celebrate the little successes, because I think that's too, like, there's so many things that we gloss on over. I mean, I was preparing for this and I was just writing some things down. I'm like, yes, because I was feeling a little beat down by that we haven't cracked the nut on the structure pieces and some of those pieces. So celebrate the little wins and share those across the state.
Yeah, so helpful. Alyssa, I so appreciate your thoughtful approach to this and this candid conversation and your advice for us. As we wrap up, is there anything else that you would want to add? Anything you want to leave us with today? Because I'm sure this conversation will go on.
Well, I would say thank you for asking, first of all. Thank you for looking outside of California for lessons learned or things. I personally am just honored to be part of the conversation. And I want to say, like, the door is open. I mean, I think it would be really cool to have some cross-state things going on too, and I think there's a lot to be learned there. So from the big giant state of Texas, I would just say to our friends in California, you're getting on the path, and that's, I know that there's a lot of great things happening in California because I work with folks in California, and I know that we've learned some things from there. So keep up the work and know that we are saving lives. I know in prevention that is so hard some days because you still see the drownings happening but we have to know that we are saving lives, and we are moving mountains. It might be one rock at a time, but we're doing that. So I just appreciate you guys and the work you're doing, and thank you for asking me to add to the conversation. And have the best day ever, because that's our thing at Collins Hope, right?
Oh, have the best day ever.
It's
It's been so good to chat with you again. And again, we're super grateful for you and the lessons that you shared with us today.
Thank you, Alyssa.
All right. Thank you
Bye.
both.
Bye.
Bye.